Greetings. Wearing my professional shirt today because I'm talking about a professional issue regarding healthcare. Anyway, there was this article that was linked to on LinkedIn this past week, and it went to a website that was called Health Leaders Media. I'd never heard of them before. I'd heard of some other things, but there you go. And the title said, or was called, How Would You Rate Your Organization's Billing Quality? And it mentioned how there were these two Johns Hopkins University professors who proposed certain ways of having metrics to look at for quality medical billing. And right off the bat, I had a problem with the article because the article said that these guys or these two professors had recently done something. And the article was, written in like supposedly beginning of February, but the study was actually done in 2020. So it's not necessarily, linked together properly. Still, I went ahead and looked at it. And what you had was you had some professors at Johns Hopkins, supposedly a great university, but they weren't medical doctors. And even if they were, medical doctors are the worst when it comes to understanding how charges are captured, how they're created. They don't know any of that stuff. They might know certain coding things, but they don't know a bunch of it. They know their own, whatever their profession is. They may know those, but in general terms, you don't go to physicians unless it's, like I said, if it's an office, you're going to see your, general practitioner, then you're going to see, certain things. The doctor's going to be able to say, yeah, here it is. Doctor's going to have a sheet. They're going to write down what certain things are. These are the things that the doctors do all the time. So they don't need to know any numbers. They just check things down. Doesn't mean they don't know the numbers specifically, but many of them don't. Anyway, they came away with these, what they said the key takeaways after doing all this study. And this is more of a doctoral study than it is a healthcare study. Trust me, when I talk about these things, I think that I will give you a little better indication of what they came up with, how they're wrong, how they may be right, what the problems might be, or what the problems were that caused these issues. So anyway, they came up with these 5 things. Itemized bills, price transparency, service quality, suing patients, and surprise bills. So let's talk about these in order. And right off the bat, I'm just going to tell you, all of these are not necessarily related to billing. Everyone wants to encompass everything under the topic of billing, but it's really not. For instance, let's talk about itemized bills. Patients don't get itemized bills. Should they? Possibly. But the reason that they don't initially send out itemized bills is because that's a whole lot of paper. I mean, if you went and just had like maybe an x-ray, then you could probably get an itemized bill that says I had a chest x-ray. I had a 2 or 3 or 4. So, different quadrants that they look at. So in essence, if it's just one thing, yes. If you went in and you had a complicated surgery, all of a sudden that's going to take a whole lot of lines out of it. And they don't want to send you that initially. If they send it to you, you're not going to know what it means. And here's the other side of that. When charges are created, charges are not created for the sake of patients. Should they be? I don't know. But they're not created for patients. They're created for having an easy way of picking the charges out so that they can show up on the medical bills. So that's what they're for. You have to have all these coded ahead of time so that they can go to the insurance company and hopefully the insurance company will pay them. And that's just how that is. There also has to be room for, the diagnosis codes and other different whole bunch of codes that are all on there. But the codes for charges specifically, they're not meant for patients. They're meant for the doctors or their staff or whomever to be able to, capture all these things. So you can't initially send that itemized bill out to anybody. However, if a patient requests an itemized bill, then they're going to send you that. But most of the time, folks are not going to understand what almost any of that stuff means. They may know a couple of those things. If it says something about, left chest x-ray, okay, you're going to know what that is. Hopefully when you came to the hospital, you were cognizant enough to know that this is what they did on you. But, sometimes things get really complicated. When you get lab tests, for instance, most people don't know what those things are. I don't know what most of those things are. There's there's something like 300, 400 lab tests that are out there. And some lab tests actually break out into multiple lab tests. So to know what all of that stuff is, that's not my area of expertise. So I don't know any of that. I'll just tell you that up front. But it does make a recommendation. Are patients given an itemized bill with easy to understand language? No, probably not. Should they be? I don't know. I think that it doesn't hurt to give people information, but if it's not going to help them, they're not going to look at it. I don't look at stuff a lot. If I get a medical bill, then I know some of the stuff I don't know, I'm not worried about it. I look for the price. And if there's a question on that, I might make a call, but I'm hoping to see what happens after insurance handles it. Now let's go to the next thing, which is price transparency. Here's the thing about price transparency that a lot of folks don't know, but this actually happened. This was something that was part of the basic HIPAA bill that was passed in 1997. And supposedly by the mid-2000s, they wanted a whole lot of facilities across the country to have a way for patients to call the hospitals or doctor's offices to find out how much a service they had was going to cost. It was supposed to be beforehand. It could be afterwards, except afterwards you probably have some kind of bill, but it was supposed to be a way for patients to do that up front. I thought that was an interesting thing. I didn't actually have a problem with it. What happened, however, is that you had a lot of hospitals across the country. Okay, I'll say maybe 5% of the hospitals actually put together teams that did this. They trained people how to talk to patients because this wasn't anything anyone ever had to do. So they did that. They had special numbers set up for them. They hired these people. That was going to be their job for 8 hours a day, answering patient questions. You know what happened? Almost no patients ever called those numbers. They just weren't ready for it, or they weren't used to it, or they didn't see the need to do it. So none of them called. And this was what you were supposed to call beforehand. So if you didn't have insurance and, you saw someone and said, yes, you need to go to the hospital to have an x-ray. And I'm picking on x-ray. It could be almost anything. But x-rays, everybody's at least had one x-ray. So if you wanted to call and say, yeah, how much is an x-ray going to be, for my chest x-ray? This person would be able to look it up and tell you that. This is how much it costs. Now, they're not going to know how much is the insurance company going to pay because that's not what those folks were supposed to do. As a matter of fact, most billing people have no idea how much the insurance company is going to pay. You don't know how much they're going to pay until they pay it. So what a patient is supposed to do after that is then call the insurance company. Say, hey, they told me this. They gave me this code on it. It's called a CPT code. This is the code talking about the procedure that's been done. And I want to know how much you're going to pay. Those folks aren't going to know. Most of the time, they don't know that unless you're at the hospital and you're telling, okay, this is telling me that this is what you're going to pay. But what does the contract say? Are you supposed to be paying me 80%, 70%? You don't really have all that information. So if you call the insurance company, the best they're going to tell you is, well, we're going to cover 80% of it, or we're going to cover 70% of it. Although that's not true either, because what they're going to pay is a certain percentage of the deal that they've made with the hospital. So let's say that the chest x-ray, the hospital is charging $100. The insurance company has done a contract where they're saying, okay, we're going to pay you $70, but we're going to get a 20% discount off of that. So they're going to pay, I'm trying to do the math real quick in my head right now. Let's see, 68, 56. So they're going to pay $56. You're going to write off 14. The patient's going to get a bill for a certain amount. and that's going to be the amount that they didn't pay. So is that $30? That's what you're going to get. That's what you're going to have to pay. Is that price transparency? I don't know. All the insurance companies basically going to tell you is we're going to pay a certain percentage of that. Did that help any? Probably not for something that small. It's not a big deal. For major surgeries, that's a different story because a lot of surgeries, you have no idea if you're going to be admitted into a hospital or whatever. You don't know exactly what's going to happen to those people. So you really don't know. That's a tough one to deal with. But like I said, there were hospitals that tried it out. Patients didn't want to call. So what can you do about it? Service quality. Now, the way that they're looking at it, they're saying, can patients speak with a billing representative promptly about any concerns and if potential accommodations can be made? I'm not really sure what that sentence actually means. Uh, I guess I'm going to say that the hospital or physicians have sent the bills out, the insurance company has paid the bill, and now the facility or the physician is putting it together, and now they're sending it out to the patient. And you get this bill, and you're looking at it, say, okay, I don't really know what this is. Wow, this bill is still $250, $300. Wow, what do I do about that? Let me call the hospital and complain, or let me call the physician's office and complain. Well within your rights. But the person you get on the phone, I don't know if there's anything they can say that's going to make you feel better unless you really can't pay the bill and you need to talk to someone to maybe get on a payment plan or to see if you qualify for certain discounts on the back end. Which, by the way, if you go to a facility or a physician that's worth anything, they've probably already got some kind of signs or something on the desk of the person that you're registering with saying, hey, we have these, what they call it charity care plans, but that's just there. But you have those options that you could do that up front. So you can find out, are you going to qualify for any of those kinds of things? But, you know, it's that question about can they promptly answer those concerns? Boy, that's a tough one to deal with. Physician's office, you might have a better chance because they're dealing with fewer codes and fewer patients. Hospital? Boy, you're not really sure. If you have basically one or two people who are the ones who have to answer all those questions, it's not going to happen. These days, as a matter of fact, there are some larger hospitals that are looking to have AI do this, artificial intelligence. I'm pretty much against that kind of thing because artificial intelligence is not necessarily going to be patient friendly. And you're not necessarily sure if they're going to understand the way that the question is asked. So it's just kind of a crapshoot out there. But that's the thing about service quality. Now, what you can do is that you can call the hospital and say, I want to talk to someone in the billing department. Okay, let's try that. Right now, there's some hospitals who are trying to kill their billing departments because they want AI to do it. That's not going to help you. You get billing people. Truthfully, if you're lucky, and this is just me throwing a guess out there, 50% of billing departments across the country are not going to be able to answer your question. I'm not going to dig into why. Maybe I'll do that for another time, or if someone asks me to, explain that further, I will, but I don't want to make this video just go overwhelmingly. But they're not going to be able to answer your question either. So that's not going to help you. If you call the insurance company, quite often, they're not going to be able to help you. I'm in the industry and I've called insurance companies and I had a little bit more information and background being able to do this. And at a certain point, they'll say, Mr. Mitchell, I'm sorry, I don't know how to answer that. And I can't be mad at them because I kind of understand. So that one's a tough one. Here's the next one. Suing patients. Does the institution sue patients for unpaid medical bills? That one's tough. I would sit here and say that ethically, I don't think it's fair. I don't think it's right. Monetarily, whew, hospitals, healthcare in general is a tough field because, you go to Walmart and you're going to buy something that costs $15. You go to the checkout, you pay $15, you're done. If you go buy a battery at Walmart, I'm just using Walmart as an example, a car battery, and it's $170, you pay $170. You're not going to an insurance company, you're not going to anybody else, you're just paying that out of pocket. It works different in healthcare because in healthcare, they base prices off of costs, general overall costs. They know they're not going to get paid that, but they're going to bill off cost, and then they're going to add percentages on it. The reason being is that initially they know that a lot of the major insurance companies are not going to pay them what they're billing them for. But at the end of the year or the beginning of the next year, you can do these things where you put together all this information saying, hey, look at this is where we're at right now. You know, we're not getting enough. And then there's this little negotiation that happens and you get a lump sum check if you're lucky. You usually get one from Medicare. You almost never get one from Medicaid. Sometimes with the Blues, you might get something. And for any other insurance companies, that might happen also, if they happen to be big in that particular region. So what happens? Now you've got these bigger hospitals, and it's mainly bigger hospitals that would do a lot of the legal stuff, where they hire someone to sue the patients because the patients aren't able to pay the bill. And when you're not able to pay your bill, sometimes you just say, you know, I can't pay the bills. I've got other bills. I need to buy food. I need to buy clothes for the kids, do whatever. That's a tough one. I don't like it. I understand why some happens. I live in New York State, and our governor just passed a bill basically throwing out suing patients for not paying their hospital bills, which is a wonderful thing. I don't know how they're going to handle some of the finances. They didn't put that in the newspaper, but I saw the other thing. That one's going to be tough. But I'm glad that they took that kind of stand, especially in the large cities where you might have large populations of people who don't have almost any kind of money whatsoever. What's the point in sending those people to collection? They don't care. The collection is not going to get anything. And after 7 years, they're going to have to write that off. Why burden those folks? So that's the suing patients thing. The last one, they call it surprised bills. So it says, are patients who pay out of pocket expected to pay more than others for the same care? Well, the way that they wrote that is bad. That makes no sense whatsoever. So let's go a different route and say, are patients who don't have insurance paying more money than patients who have insurance for the same care? Yes. Are they being billed more up front? No. But if you have a $300 bill and you don't have any insurance, yes, you're going to have to pay $300 because that's how much you're being charged. If it's going to your insurance and the hospital has a contract with that insurance company, then you're going to end up paying less out of pocket than you would have if, you didn't have any insurance. That's just how that is. Is it fair? It's a hard one to say, but, that's just pretty much how healthcare is. It's a totally different animal. If I had my way and I didn't have to worry about the fact that I've got a whole lot of staff in this big old hospital that I have to pay, and I have to pay a lot more to the physicians and a lot more to the nurses than anybody else, and I have to make sure that all the regulations in the facility are covered so that we don't get hit by the Office of Inspector General for bad quality and some of the other things. If I didn't have to worry about any of that, I would say, nah, we're not going to do any of that kind of thing. But I don't think that's a surprise bill, because if folks knew what they were going to have up front, then that's one of those kind of things where they should be able to call the hospital. Hopefully those hospitals will have someone. And by the way, like I said, I understand how this works because I have done my own little kind of testing here and there, not locally, but I've done it where you call and you get transferred 4 or 5 times. Heck, working in the hospital when you're trying to talk to someone in another department. and they're not able to answer those questions. And I'm like, what the devil? Y'all work there. A lot of those people don't know those answers. So I wouldn't necessarily call that a surprise bill. To me, a surprise bill is if you get something, you've paid it, and then out of the blue, here comes something else. To me, that's a surprise bill. That shouldn't be allowed by anybody. If a facility or physician does that to you and you thought you paid your entire bill already, that's one where I say, yes, call up someone at the hospital and fuss about that, because that's not right. I don't necessarily even know if it's legal. I don't think I've ever worked at a hospital, and I'll say this since 1989 because I didn't know enough about the first hospital I was working at to know if they did that. But any other hospital afterwards didn't do that. Why? Because I was in the position where I could go talk to all the different department directors, where I could talk to, medical records and all these other different people. I was the guy in charge of actually creating certain charges, recoding certain charges, repricing certain charges. So I had that, and that never happened with me. I mean, it is not an easy industry. Healthcare is the only industry overall, not 100%, but probably at least 90%, where whatever your price is does not mean you're going to get paid that. So you have to come up with ways to try to save money on costs and try to find other ways to generate income that you can get paid for that's legal. And I've done something beforehand talking about capturing supply charges and stuff. If you search that through my page, you'll find it anywhere, somewhere here, but I've done it. Anyhow, that's what I have. It may seem like I was all over the board, but it's not an easy kind of question to answer. And I'm in the field. Having a couple of professors at Johns Hopkins who are not in the medical area, but they just looked through a whole bunch of data, it can't be anywhere close to being accurate. And there's a difference between a hospital that has 1,400 beds and a hospital that has 150. They're not the same thing. Anyway, that's all I have. Y'all let me know what you think. My name's Mitch Mitchell. Hope you have a good day.